If you are a psychologist, a mental health practitioner, a psychiatrist, or working a lot with clients who come with severe mental health conditions, and you also want to know more about complex PTSD or CPTSD, then this video is for you. I'm very happy to announce that we had published the first of its kind research paper from India on complex trauma, which was published in the European Journal of Trauma and Dissociation. This came out in their October 2024 edition, and the name of the paper is The Effectiveness of Reconsolidation of Traumatic Memories for Complex PTSD, a pilot quasi-experimental study from a wellness center in India. The authors are Dr. Gunjan Trivedi, Neha Pandya, Parishi Thakore, Hemlata Ramani, myself, and Soundarappan Kathirvel. This research paper is very unique because, one, in India, there is very limited research, very few studies on complex trauma and how to address it. We all know that ICD-11 today clearly differentiates CPTSD from PTSD. Once it is differentiated, we also have to find ways to understand CPTSD and to help people overcome it. We at Wellness Space have been using a technique called Reconsolidation of Traumatic Memories, or RTM, which has proven to be very effective for bringing down the scores of our clients on CPTSD. And hence we have published this paper. It is in a tier 2 journal. It is obviously approved by the ethics committee, and it has followed all the standard procedures that are required for it to be accepted in a journal of this stature. Let me tell you a little bit about this research. The research was conducted with 107 participants who were all assessed for CPTSD using the ITQ, or International Trauma Questionnaire. They were also assessed on Major Depression Inventory, or MDI, and GAD-7 for Generalized Anxiety Disorder. Based on index trauma, so we identified what, of course in our training we do teach how to use RTM, and how to use index trauma is one of the ways to identify the events which we need to work on. So we did index trauma. We did a series of sessions with them. We measured their progress after a month, after 3 months, and we checked if there was any change in their scores. The results show that after 1 month, the CPTSD status of 80 of these participants changed to none, and 2 of these participants, the status changed from CPTSD to PTSD. The results were sustained even after 3 months when we reached out to them for their scores. So this is a very effective method. If you are working with people with complex trauma, you can learn how to assess it and how to also help people heal the CPTSD using RTM. We regularly teach RTM and index trauma approach to dealing with trauma in our training program, which is the Evidence-Based Psychotherapy Program that we teach. If you want to know more about this research, the methodology, what was done, how was RTM used, etc., then do check out this paper. It is available on PubMed and Scopus on the World Wide Web. You can search for the title of the paper, or you can search for the names of the authors. Remember, this paper is very special because it is first of its kind from India, and we hope to keep contributing this way more and more in the field of research and psychology, as well as psychological interventions, so that we from India also have a feeling of being proud of having contributed to this research, because most of the research on childhood trauma or PTSD or CPTSD only has been coming from the West, and it is high time India, with more than 400 million young individuals, needs to have more such research happening on trauma, on PTSD, CPTSD and mental health. What are your thoughts on this? Do share in the comments below.